another episode of
Mimi's Corner and Child.
Was that helpful for you?
It's okay. But yes, welcome to another episode of Mimi's Corner. I'm sitting here with the lovely Daniella.
Hi.
Where are you from?
I'm from Brooklyn.
We are talking about fertility challenges within our community. I brought Daniella on because she has experience working in a fertility clinic and she's currently a therapist. So I am so proud of you. She has her master's in marriage and family therapy. So she's just going to talk a little bit about some of the challenges that she's come across while working in a fertility clinic. So thank you for coming.
Yeah.
So first, let's start off with your transition from being an educator into a therapist.
I don't even know where to begin with that. Well, okay, so I always knew that I wanted to be a marriage and family therapist. From young, I transitioned into education just to try something new and to just figure out what I wanted to do. And what was it, about like 2 years in, I decided that I actually wanted to pursue my passion of being a family therapist, especially because like, the emotional challenges that I would some of my kids undergo, which really just stemmed around friendship. I felt like I wasn't in the right place. So yeah.
Okay, so how long have you been practicing?
For about 3 years now. I interned for 2 years and I'm officially in.
All right, so congratulations to you, Daniella. Again, let's start off with working in the fertility clinic. So most times you hear within our community, we don't hear women talk about the challenges. We only hear about the after. Like, I've been trying for so many years or months, didn't know that I could or couldn't have a child. You're assuming maybe I need to just get some birth control from the doctor to regulate my period and then I should get pregnant. Or let me check to see if I have fibroids because we know so play a role in infertility.
Yeah.
So my question to you is, working in a fertility clinic, how many African Americans have you come across that were trying to have a family, and what are the costs like?
Child. Okay, so the fertility clinic that I worked at, I would say that the waiting area definitely wasn't full of Black and brown women. This particular fertility office that I worked there in undergrad, and then I also recently went back during grad school. So the first time around, I really didn't see people, Black and brown women of color. I would say this time around it was a bit more, but out of the average, I would say literally a handful, probably like somewhere between 5 to 10.
So in that space, it was mostly people from European descent coming in. So what are the costs to go through with the treatment? How successful is it? Who are the egg donors?
Okay. All right. So going through the treatment, the average cost of an IVF cycle, which is in vitro fertilization, is anywhere between $10,000 to $15,000 out of pocket with your insurance, depending on your insurance. Depends on the coverage that you'll receive. A lot of women would come in and try to like freeze their egg. A lot of insurances don't cover like freeze cycles unless you have a medical egg freeze. And so a medical egg freeze would be if you have cancer and you're going to undergo like any type of chemotherapy, you would come in and freeze those eggs. Average cost is like about 10 to 15. And that doesn't even include the cost of medication. And so a lot of insurances don't even cover the cost of medication. And so you're probably going to average somewhere between 2 and 5,000 for medication.
Wow. That's a lot. Do you think that the reason why there aren't that many African American women go for IVF is because of the cost? Do you consider that space to be limited with resources, or do you feel like we African American women just aren't interested? You know what? It wasn't meant for me to have children, so I'm not going to even bother having to pay because if God wanted me to have children, I would. Do you think that plays a role in why women of color don't go for it?
So I think that yes, and so the and would be, I think, those that do, when they do end up going for fertility treatment, it's in the later years, right? Mm-hmm. I think that when you go to your doctor, your GYN, and you hear like it's not only fibroids that causes infertility. Any ovarian type of like dysfunction can cause infertility, including endometriosis and just like other factors, right? And so I think that when people do get the diagnosis of like having fibroids, PCOS is another like big factor of infertility as well, polycystic ovarian syndrome, for those who don't know. And I think that when you hear that and like the first thing that you think, wow, I'm going to ask my doctor, and I'm going to speak from my own experience, right? And so I'm going to ask my doctor, what are the chances of me, having fertility issues, in the future? And sometimes, depending on where you are, you might hear you won't be able to, X, Y, and Z factors. I think that that's why a lot of people don't necessarily consider fertility treatment, in addition to other impacts like belief. Maybe they're waiting, for God to pull through for them. Maybe it's just a thing that runs in the family. So and so on, and this aunt and that aunt like had those issues. And so when it comes down to me, maybe I'm not knowledgeable the resources that are there out there for me, or maybe I've done my research, but maybe I don't have the right insurance that's going to cover it. Maybe I can't necessarily afford to do that. And so I think those are just other barriers. So yeah.
In terms of health insurance, you mentioned that not every health insurance accepts it for a medical reason. About to undergo cancer treatment, so you want to freeze your eggs so that after you're done and chemo is clear, you can start the process. What health insurances cover this, and how do women of color gain access to the resources that are available?
Girl, okay. Most major insurances cover fertility treatment. So in the particular office that I worked at, we didn't accept Medicaid health market. And then also it's just a lot to unpack with that. Typical insurances such as Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, those major ones do cover.
Do they cover the full cost,
No,
or you pay?
I think also it depends on your employer as well. But no, I'm gonna say no. The only really, really great, I would say, like insurance that covers majority of the cost is called Progny insurance. Progny for anyone who wants to look it up. I don't know the cost of it. I do know that there are programs out there like finance your cost of your fertility treatment, and they have like specific caveats. Maybe I decide to do this one cycle, and then I decide that I don't want to go through with the others. And so they have like different things that you can like negotiate, but it's basically like a loan.
I asked you earlier on about who the donors are. I remember being a kid and I'm like, how you get $8,000 if I give my eggs?
It's actually 10.
Oh no, it's 10. But at the time I remember it was like 8,000. Oh, I can do this. Yeah. And I was like probably in my early 20s, and I thought about it, but I didn't go through with it. You hear $8,000, $10,000. Oh, it's a lot of money. I might as well go and try to see if I can get some coins. But I never followed through with it. It was just an idea like, oh, that's how much you get. But you don't really understand the mental part of it. It's like, oh, this is money. But then again, within our own community, we have so many health concerns that put us in a position where, no, we're not going to take your eggs. You have this, that, and the third. You have diabetes, hypertension. You have all these ailments. Well, you know what? Your eggs aren't good.
Think about it this way. If I'm a woman of color coming into a space where I'm looking to basically have medical assistance with conceiving, and let's say that for whatever reason, my eggs aren't that great to use, right? Or I don't have good quality eggs for whatever reason. Let's say that even my egg reserve is low and I need a donor, or I've aged past like the cutoff limit and I need an egg donor. Or let's say that my partner basically is Black and they don't have, for whatever reason, their sperm is not good quality, right? They shoot in blanks or whatever.
Not
I don't think
blanks.
that, girl, it's like there's not enough representation of us with egg donors and sperm donors, right? And so let's say that I really am passionate about having, a black and brown baby. I'm not necessarily going to lean towards, that, there's some people out there that would want to, but I think that that's another thing that kind of shies people away from it. Let's say that I want to get somebody that I know to like basically be my egg donor, be my sperm donor, because it just makes it easier for me to find my own person. I think that's a whole nother thing in itself. Finding the right person. Do you trust that person? Is that person going to be consistent? Are they going to follow through? For some, it might be an awkward conversation to have.
I just heard you mention partners. So when it comes to infertility challenges, most times we don't talk about the male perspective. Of course, we aren't men, so we don't know exactly what they're going through. In most cases, it's like, I can't believe she lost the baby. Oh, I feel so sorry for her. Oh my goodness, I can't imagine what you're going through. And there's a lot of focus on the mother. And we don't think for a minute that maybe the partner, the husband, the boyfriend is experiencing the loss because he's not carrying the baby, he's not going through it. But in some way, it does have an impact on their mental and how they handle whatever else is going on. And they possibly may be feeling the same thing because it's technically their child. They're going through the whole process. They're going to the doctor visits. If they have to come in and like a specimen for the doctor to test to see how high the sperm count is, and it's just like, okay, now we have the sperm count high, but the embryo isn't developing or whatever. So now we have to try again, and there's just thousands and thousands of dollars that you're putting into this because you want to start a family. And now every time, or just that one time that you tried, it wasn't successful, and you now as a man are feeling like, what can I do? How can I support her? Like, have you seen any instances where the male was visibly crushed or just disappointed? What do you think from a therapist side? How do you think they handle it, and what are some things that come with, oh, okay, you didn't have a baby now? So is it like, I'm mad at you? Are you mad at the woman because she didn't have the baby? So what are some of the things that you can like discuss or share?
So I wouldn't say that necessarily I witnessed like a male being crushed like in office and stuff like that. But in my program, because like fertility, like mental health, and specifically, women's health, and then even couples, right? And just how they deal and go through infertility is something that I definitely did a lot of research on and presentations paper. In addition to talking with some individuals, right, in my internship about like their experiences with loss in that regard. And I do want to say that in addition to talking with different patients, right? So fertility treatment can feel isolating. Even though I can have the support of you, I can have the support of my family, but to a degree, you don't fully understand what I'm going through. And earlier that I realized I didn't answer, how successful is it? So it just varies from person to person. My bodies might respond to the treatment differently from your body. And just trying to get all of my thoughts together.
It's okay. Take your time. Like they say at church, take your time.
Right? Oh my God.
Take your time, baby.
But basically, someone can literally come in and have their first cycle and they get pregnant, and that's a success. Versus someone.
When you say cycle, is it like the 30-day cycle, or what type of cycle is that?
So when you do fertility treatment, when you're doing the IVF cycle, whether you are only doing the egg freeze, or doing the egg freeze and the embryo transfer, I can't really estimate how long, but it basically depends on your body. But basically, you probably have about a week or two where you're taking the medication. You start your cycle around the time of your period, so you'll wait for your period to come in, and you start your cycle around the time of your period. You are basically going to be coming every day for about like a week or two to do blood work. And just like to check your hormone levels, to check your follicles, like to do all of that. And so when you are ready, then you'll do your egg freeze. After you do your egg freeze, if you are doing IVF, fertilizing your egg, your partner will come in, he'll bring in his sperm, they'll do a semen analysis, all that stuff, and they'll basically make the embryo. They'll make the embryo, they'll basically run genetic tests and screening on your embryos. And they'll let you know basically which ones were successful, the quantity, how much was successful. And if you just do your egg freeze, they'll let you know the quantity of how many eggs they were able to retrieve from you. So basically, that's what I mean by the cycle. What was the question again?
No, we were talking about the mental side of it with the male perspective, and you were talking about within your practice as a therapist and your research and papers. I could imagine that as a man who is trying to do the best he can in terms of supporting his partner, his wife, his girlfriend in the process, taking out the money factor, but just, you just mentioned going to the clinic every single day. So that has to be not only taxing on the body, but it can cause a lot of stress and it's taxing on the mind. Yeah. So I'm wondering what the relationship looks like. Is, of course, you need support, right? You need your partner to be there. But then when it's not successful, well, you know what happens next. Sometimes you may have a partner that's like, let's try again. There's a flip side where it's like, I'm not spending another dollar doing this. And it could possibly lead to abuse.
Yeah. That's what it says. So like basically it can feel isolating was where I left off at. And yeah, like you mentioned, I'm coming in every day to get my blood drawn. I also am on a time schedule of when I have to take certain hormonal medications, which is already like impacting your hormones. Yeah, I do think that the focus of women, like, I don't want to exclude their experience, but this can cause relational distress. And what relational distress is like any type of strain on your relationship. And so maybe we've been doing this for about a year. We haven't been successful. And then I'm telling my partner that basically, like, I want to keep trying. But my partner might, on the outside looking in, be looking at me, well, this is how it's impacting you. Like, it's making you sad. You're unhappy. You're stressed out, right? In addition to, like, maybe we're not connecting as much. Maybe we keep arguing because, like, this is not going well. Maybe we're both feeling hopeless because we want to build and have a family, but like the stress of this and whatever amount of times that we may have been unsuccessful is causing a strain in our relationship, and I don't feel as connected as you. And so a lot of the articles that I did, like, read up on and did my research on, and I could share them with you so you can share with us. Also basically about how, like, in the initial phases, they're supportive of each other, and we're here and we're there, and I got your back, you got mine. But as people are going through multiple cycles, and finances plays a big factor in it, and how finances affect relationships and stuff like that. But basically all of that can cause stress, which can lead to more arguments. It can lead to distance within the relationship. It can lead to animosity and resentment. Like, maybe you're losing the support of your family at this time, right? Where your family members are probably telling you, like, girl, like, you should stop, or whatever thing that they might be saying. Like, maybe you're losing the support of your family, and so it starts to feel like this big circle of support that I have starts to feel really, really, really small. I'm starting to feel like no one around me basically is understanding what I'm going through. They don't know how hard it is, right? They don't know what it's like to have like medical condition, or there's two different types of fertility. So like people who have medical conditions and it's their first time getting pregnant, and it's been about 6 months to a year and they haven't been successful. That's like type 1. Type 2 would be like, I've already had a baby, and I'm trying to have another baby, and I'm just unsuccessful in having that second baby. And so whatever the situation is, maybe I'm noticing that my support is getting smaller. And so if I just have my partner, and it doesn't feel like we're connected, and I don't feel that same sense of support, and we're getting arguments. Eventually, that can also lead to domestic violence in those relationships, right? It can also lead to potential infidelity, basically the demise of a lot of relationships because of the strain of treatment. So,
wow, that was a lot. It's the truth. And I think that it's important for us to have these discussions and talk about both sides,
right.
when it's successful and when it's unsuccessful. When it's successful, it's like, yes, this is amazing. God showed up for us and we have a baby. Especially if you're someone who is a believer, you're relying heavily on praying, fasting, and just trusting and believing God to answer that prayer. But then if it doesn't work out the way in which you envisioned it, it's like, okay, we're going to do this. This is a cycle. I put my money aside. Everything is, I'm doing what they say. I'm going to the doctors. You're checking my levels. We're starting the cycle, and then it doesn't work. And then you're like, what is going on? Like, there's no way that the God I serve will believe would do this to me. There, I'm quite sure, are people who feel like God doesn't exist. This can't be real. Why would you make me spend all this money, go through all this treatment, and then this happen?
Right.
Why would this happen? So
it just can be really discouraging.
Absolutely discouraging. And in our community, it's so crazy because if you have your baby too early, you're fast. Right. You were doing too much. You had no business having a kid so early.
Yeah.
You need to wait until you get married, right? Then if you're a woman who decides, I'm not gonna get married because I don't want to, but I'm gonna have my children. Oh, she should have waited to get married before she had them kids. Then you get to your late 30s and 40s, and like, she ain't never had no baby. She waited so long, and it's just a conversation that we need to have about not having those conversations with women and telling them you should have been had a baby, or they're married and they've been married for 4, 5, 6, even 10 years, and you're in a room full of people and you say, girl, when you gonna get that man a baby?
Child.
And it could be they tried. They probably had multiple miscarriages. They probably even had a stillbirth.
Right.
You know, it's a sensitive and touchy subject, and it's really not our business to discuss unless somebody comes and shares that with you and says, you know, girl, this is what we've been dealing with. And then if somebody shares that with you, it's not for you to talk about in a public setting or even in an intimate setting, just because you don't know how that person is going to handle it in a moment. And you might say something that triggers them and causes them to feel like, oh my goodness, I cannot believe that this person in this moment betrayed my trust, or assume that this is something we should be talking about. And, you know, we have to kind of take those ideas of, you better have that baby before you're a certain age or you're going to have problems, and just let that person deal with whatever it is on their own. And I've gotten to the point where I was just like, I don't even ask.
Child,
I don't ask. Or sometimes you see a woman and you're like, oh, congratulations. And it's like, congratulations? Who could for what? And it's like, oh my goodness, I thought you were pregnant. And they could be dealing with fibroids, and now their stomach looks like they're carrying a baby, and they're not carrying a baby. And you just told somebody congratulations, a person that may have had multiple miscarriages. So you don't want to go out there and say something and literally put your foot in your mouth, make somebody uncomfortable. You're uncomfortable. I've done it before where I've said to a woman, oh, how was your Mother's Day? You know, you assume and I said this because I used to see her all the time with a little boy. So I'm just like, well, had to be her grandson, child. And it's like, she said happy Mother's Day to me, and I was like, how was your Mother's Day? I'm not a mother. And I'm like, okay, ma'am, I'm sorry. And I just was like, you know what? I have to be mindful. Not everybody is a mom. Not everybody was able to conceive, and then some people just don't want to have kids.
I was actually about to say that some people don't just don't want to be moms. Yeah.
Some people just like, I'm happy. But then there are those families or those people who, you know, they waited for their husband, got their husband, and I'm going to have my family.
Yeah.
But then it's like, I have my husband, he wants kids, and I don't. And it's like, well, why didn't you tell that man that before he went and, proposed? And girl, you tired?
Sorry.
Let your yawn out. Let your yawn out. Because you come from Philly, you want to be yawning.
Girl, like, okay. I was trying to do the close.
Get your yawn out. You done?
Woo, I think I'm good.
Okay. Yeah. So, are some women who just don't want to have children.
Right. I think, too, pregnancy is a beautiful thing, but pregnancy can also be traumatic. And, like, even another part that I didn't even bring up is that sometimes people have to have a D&C, which is basically a procedure for miscarriage, because maybe there's something wrong with their embryo, maybe there's something wrong with their baby. And so I've waited all this time to finally get pregnant, to have to basically terminate this pregnancy, and that's not an easy decision to make. And so also, women of color, hello, preeclampsia is a thing. Like, there's so many different health concerns that we have, especially when getting pregnant, that pregnancy is traumatic, and it can be traumatic. And so even going through fertility treatment can be, yes, stressful, but it can also be traumatic in itself. So I just think about that. And I agree, because I was tired of, like, after my sister had her baby, and I would walk around with my niece, and we basically do look alike, right? But people would be like, daughter looks so cute, and I'll say, yes, okay, thank you. But then also I have people be like, so when are you gonna have your baby? Like, hold on. Yeah. Like, hello? Miss, ma'am, are you paying for diapers?
Well, are these people that you know?
Yeah, like people in church.
Okay. So, you know Haitian people.
Girl, and I'm like, hold on, how? First of all, like, child, no. And not anytime. Well, not yet.
But then it would say that too, like, when you gonna have a baby? Somebody in church telling you when you gonna have a baby. It's like, well, first let me get a husband. And why would you even ask me about when I'm gonna have a baby?
Child, it got to a point I started telling people, my baby is bacon in my imagination. Because
so clearly, do not ask a woman when you're gonna have a baby. Also, going back to what we were discussing earlier with causing stress in your relationship, check on the men.
Yeah, I was about to say that.
Yeah, check on the men, because there are men who want to have children, and sometimes they may say, you know what, I would like to have children, but my woman doesn't want to have children, or she may be having issues with fertility, and it's like, I'm not about to go through this. I don't feel like being bothered. So that can also be stressful too. If you know, like, I want a child, my wife says she wants a child, but she's not taking the steps to do it, and I'm all for it whenever you're ready. Right. You can't force it on a woman.
I do agree with checking on the men, though, because I think I was talking to you the other day. Well, when we were talking the other day, a lot of things that we go through, your partner is also experiencing the same thing. They might not be outwardly expressing their sadness, their grief, their anger, their frustrations. They might look calm and cool, calm and collected. Also, you don't know. Essentially, maybe they feel like they have to be the strong one for the both of us. And so I do think that checking on the men is definitely needed. It's not an easy thing to go through, and it can definitely feel isolating. So
I think that even with this, as we know, that it can lead to domestic abuse, but it can also lead to divorce. Yeah. And when you think of the divorce rates within our community, and even now, like, the marriage rate isn't as high as it used to be. I remember, my mom being married and all her friends getting married around that time. So everybody was just getting married. Are you going to get married and stay married? Or are you going to, say, you know what, I'm done with marriage. I'm not going to try again. Yeah. I already have my children. I don't want no more. Yeah. There's so much that happens in your own life where you're probably like, I'm good. I'm good. So